So if you're only missing one tooth, why a dental implant over a traditional bridge?
So basically, if you're missing a single tooth, you basically have two options. If you're going to go with teeth that don't come out, you have two options. One option would be a bridge, which has been there forever. I mean, we've been doing bridges for many, 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 many years, versus an implant. And I'll tell you the difference between the two. A bridge, although it's good, it's fixed, it doesn't come out. The problem with a bridge is you actually have to carve the teeth adjacent to the bridge so that the bridge can sit and stay. Now, what's the problem with that? Although it's quick, you get it very quick, relatively very quick, you get a bridge fixed and cemented and it's done. The problem with that is by carving the other two teeth, right? If you get a cavity in the future on either of those two teeth, the whole bridge has to be changed now.
Okay.
And here we go again. You got to remove the bridge, and financially it doesn't even make sense because the price of a bridge and the price of an implant is about the same. And the good thing about the implant is you don't have to touch the other teeth. You don't have to touch the adjacent teeth. It basically goes into the area and it replaces the one tooth that you're missing with a single tooth implant. So in the long run, it's cheaper, even though they're about the same price.
What about pain?
Well, pain is usually something that they don't complain about.
Okay.
Because when we place, the amount of anesthesia that we have to give to place an implant is the same that we're going to do a filling. We don't give more anesthesia than that.
Okay.
And the only thing that we did the anesthetic for is actually for the gums, not even for the bone, because the bone has no sensitivity in it.
Okay.
So you can actually go through the bone without anesthesia and they won't feel anything. So pain is usually a non-factor. And with the advances of dentistry, with guided surgery, which means that we take a 3D scan, right? And we're able to place the implant on the X-ray, on a computer, prior to even going to the mouth, we can actually do the whole implant as a closed procedure. That means that we don't even have to cut through the gums or anything.
And this can be done in one day?
And this can be done in one day.
Now, and you have a machine that makes the teeth?
We have a machine that makes the teeth same day tooth,
All right
same day crowns, same day veneers. So we do it the same day. Patient comes out with the tooth.
So if it was a family member of yours, a close family member, and they were missing one tooth, like you would no way do a bridge on them?
Of course not.
You would always go there.
There is no way I
So
would
in
do
your
a bridge.
practice, you're doing bridges probably. So
Yes.
you think people are just afraid of the implant? I mean, if it's less in the long run,
Yeah, people are sometimes
they hear surgery or?
people are sometimes afraid of the unknown.
Okay.
And that's a big thing because they think of an implant, they think of a surgery. And no, I don't want surgery, you know? But what they don't know is that it's easier to place an implant. When we do guided surgery, you know how long it takes me to place an implant? About 10 minutes.
Is that right?
10 minutes, I'm done.
So they walk out with a tooth.
The implant is done in 10 minutes. Afterwards, we make the tooth. The computer has to fabricate the tooth and all that. But the actual placement, the actual surgery, it's about 10 minutes. That's all it takes.